Hello, my name is Neka Okonkwo, and in this presentation, I'm going to be talking about caring for the mental health needs of special populations, such as the elderly or geriatrics, perinatal or lactation, pediatrics or adolescents, LGBTQ population, immigrant or migrant workers, and a minority group, in this case, the African American population. Older adults often face depression and anxiety, especially in nursing homes, but these issues can be hard to spot because they are masked by other health problems and memory decline. Medical practitioners should consider each person's full background, including health, finances, social factors, and the effect of COVID-19 when diagnosing geriatric anxiety. Since mental health symptoms often overlap with other illnesses seniors face, there's an urgent need for more research and better services for elderly mental health. Mental health problems in older adults need to be identified and treated quickly using the DSM-5 guidelines and various other screening tools. No single test covers everything, so practitioners often mix and match tools and perform lab tests to really figure out what's going on with the patient. Some of the tools used are the MMSE, ADAS-COG, CDR-SB, and ECOG. But the main issue is that the care needs to be tailored to a specific patient. In discussing treatment plans for the elderly or geriatric patients, standard care should be carefully choosing and managing medications and therapies based on each patient's needs, especially considering how aging affects medications and side effects. Practitioners should start at lower doses when prescribing, stay alert for interactions, and work with families and care teams. Polypharmacy, which is taking too many medications, raises the risk of missed doses and side effects. So routines should be kept simple and education provided to patients and caregivers for better adherence and safer care. Perinatal and lactating patients are particularly at risk for early onset mental illnesses like depression and anxiety, which can harm both mothers and children. Specialized, timely screening and interdisciplinary approaches are critical, especially for vulnerable groups such as migrant mothers. There is increasing prevalence among subpopulations like migrants, highlighting the need for tailored screening programs. Addressing these conditions benefit families and public health by preventing higher future healthcare costs. About 1 in 5 women are affected yearly, creating significant healthcare strain. Economic impacts include direct care costs, lost productivity, effects on children, and more demand for mental health services. Full societal costs are underestimated due to lack of long-term studies. Policymakers need better data and cost analysis for guiding resources allocation and promoting early intervention. The DSM-5 diagnostic criteria for perinatal mood disorders during pregnancy and up to 4 weeks after birth. Criteria includes depressed mood or loss of interest, appetite or sleep disturbance, fatigue or low energy, feelings of worthlessness or guilt, poor concentrations. Symptoms must last at least 2 weeks and cause impairment. DSM-5 distinguishes between normal mood changes and pathological depression in pregnancy. Screening tools that are used sometimes include the Edinburgh Postnatal Depression Scale or Patient Health Questionnaire 9. Lab tests like thyroid and anemia screening can help rule out medical causes. Combining these tools increase recognition, especially in vulnerable migrant groups. Treatment plans for lactating or perinatal patients include pharmacologic interventions, non-pharmacological interventions, and holistic mental health care. Under pharmacological, you have SSRIs, which are the first line due to its stronger safety data. All medications require monitoring for side effects in infants and mothers. Assessment for contraindications and risk-benefit discussions with patients are very essential. Under psychotherapy, you have cognitive, behavioral, and interpersonal therapies as the first-line options. They can be used alone or with medications as appropriate. Under collaborative care, team-based approaches should include obstetric, psychiatric, and pediatric expertise for coordinated planning. Patient education should focus on symptom recognition, understanding treatment risk and benefits, and self-help strategies. Higher social support from family or peers improve outcomes and reduce feelings of isolation. Referrals to lactation consultants and support groups help address breastfeeding issues and provide practical and emotional support. Pediatrics and adolescents have different mental needs than adults because they are still developing physically, emotionally, and socially. Clinicians must recognize that kids might show depression as irritability or show anxiety through disruptive behavior. Using age and cultural appropriate tools is vital. Treatment works best when families, schools, and communities work together in a supportive, family-focused way. Epidemiology and cause anxiety and ADHD are especially common mental health issues for young people. ADHD affects about 5 to 7% of children around the world, and anxiety disorders may impact 10 to 20%. These conditions start young and often last for years, influencing kids and their families through school challenges, social interactions, and even later mental health. Expenses include direct costs like medical care and therapy, and hidden costs as parents may need to take time off work. All these challenges affect not just families, but also education and social systems. DSM-5 criteria guide is used for diagnoses like ADHD, anxiety, and mood disorders in youth. Assessment tools must adjust for age, language, and development. Multiple sources, such as parents, teachers, and observations, help form a full picture. DSM-5 criteria guide diagnoses like ADHD, anxiety, and mood disorders in youth. Assessment tools must adjust for age, language, and development. Multiple sources, such as parents, teachers, and observation, help form a full picture. Treatment strategies are tailored to developmental stage, symptoms, and family situations. Medication dosing and effects differ from adults because it requires close monitoring and family education. Psychotherapy, especially CBT, and family treatment work best with caregiver involvement. Schools can help detect and manage mental health issues and provide interventions. Coordination with pediatricians ensures care continuity and ongoing monitoring. Educating families supports treatment understanding and continued care at home. LGBTQ individuals face higher rates of depression, anxiety, substance use, and suicidality due to stigma, discrimination, and identity-based stress. Assessments should include evaluations of sexual minority status, identity-related stresses, and gender identity. Modified intake screening processes that foster trust and inclusivity are critical. These mental health issues contribute to higher healthcare costs, disability, and lost productivity. Early affirmative treatment reduces both psychological and economic burdens. DSM-5 assessment should be adapted, consider identity-related experiences and minority stress. Tailored diagnostic techniques improve documentation and client-provider trust. Affirmative and client-centered approaches help identify risk and foster honest symptom disclosure. Evidence-based care includes psychotherapy like LGBTQ affirmative CBT and pharmacotherapy tailored for hormonal or medical needs. Clinicians need cultural competence and should affirm identities in communication and environment. Safe, affirming spaces and referrals to trained providers are essential. Use of community resources and multidisciplinary teams strengthens support, reduces isolation, and improves outcomes. Immigrant and migrant workers face unique mental health challenges due to migration stress, economic hardships, and barriers to care. High rates of depression and anxiety are linked to migration, loss of resources, and unemployment. These issues lead to economic impacts such as increased health service use, lost productivity, and health disparities. Migrants often fail to adhere to treatment due to communication barriers and cultural differences. Standard diagnostic tools like DSM-5 help but can be limited by language and cultural differences, risking misdiagnosis. Trust, culturally appropriate care and services in the patient's language can improve access and adherence. More research, adapted care models are needed to close service gaps for this vulnerable population. Immigrant or migrant workers' treatment strategy include pharmacological interventions, for example, with SSRIs, psychotherapy, for example, CBT, collaborative care models with primary care and mental health care, social services, and interpreters, careful medication selection, accounting for comorbidities, exposures, and side effects. Patients' education on warning sign, adherence, and stigma reduction should be taken very seriously. Ongoing monitoring and assessment is very crucial. African Americans face increased mental health disorder rates and unique barriers, including access, stigma, and discrimination, which worsens economic and social outcomes. Primary care must address cultural differences in diagnosis and treatment to provide effective and sensitive care. The DSM-5 is used by most providers, but cultural differences may lead to misdiagnosis. There is a need for context-aware diagnostic methods to avoid missing culturally influenced symptoms. Treatment planning includes pharmacological, collaborative care and psychotherapy, and assessment and planning. Under pharmacological treatment, it is important to consider genetic and cultural factors when prescribing medication and providing education for those medications. Patient trust and adherence can be impacted by past unethical research and side effect risk. Under collaborative care and psychotherapy, team-based interventions and therapy like CBT are recommended. Culturally relevant stressors and history should guide care plans and patient education. Under assessment and planning, use culturally validated assessment tools and combine with clinical interviews and relevant labs. Apply evidence-based, culturally sensitive treatment recommendations and explain choices clearly to improve engagement and outcomes. And these are my references. Thank you.